we start, I'd like to acknowledge the traditional custodians, the lands that we meet here today on, the Ngunnawal people, and their contribution to our daily life. I also would like to acknowledge other Aboriginal and Torres Strait Islander people who've made this beautiful country their home. And I also want to acknowledge our continued connection to our Mother Earth, the waterways, and the sky, as they are very important to our cultural understanding. So, just to introduce ourselves. Uncle, would you like to go first? Okay.
You can go.
So I'm Joyce, so Yama, which is hello in my culture. I'm Joyce Graham, and I'm a Galimaroi woman from Mowgee, New South Wales. And I've been living and working on Ngunnawal country for quite some years, but in this role as a manager of the ALO service for 16.
Okay, I'm Barry Collins. I'm a proud Wiradjuri man from central New South Wales. I've been in Canberra now for 6 years and living on the Ngunnawal country, which I'm quite proud to do. And
Thank you. So, Uncle, we're here today to talk about cancer and cancer journey and the Canberra Hospital. So, if things get a bit and you need a break, let us know.
okay.
So, I guess the first thing people are really interested to know is some of the common difficulties other Aboriginal Torres Strait Islander people have coming here from off country for treatment. What do you think some of those might be?
Well, I came here and I did 13 weeks treatment here. I found that coming here, I never had the mob, except for a son, and everybody else sort of came in over a weekend because I had the weekend off, but I did the other 5 days for that 13 weeks. And I think it's important that they understand that as an Aboriginal person, you have a lot of family or a big family, and they can all turn up. So you have to look at accommodating them or arranging some way that they can get together somewhere around the clinic here.
I agree. There's some of the major issues that I am aware of that happens for Aboriginal and Torres Strait Islander people coming to Canberra. The other thing is accommodation. There needs to be a place where they can come and have family come. Also, for me, some of the things I have to support Aboriginal Torres Strait Islander patients through their cancer journey is sometimes they need to go off country to make decisions. So sometimes the surgeon or the doctor, the oncologist wants them to hurry up and make decisions because we got to get this treated. Where a lot of the mob need to go home and talk to community, talk to their family, so it's like they need that time, because it's like a roller coaster ride when you first get diagnosed. Was that for you?
Yes, it was, and there wasn't a lot of backup from that. I found that it was just my wife and I and my son and his family. But then I had extended family away from Canberra, which made it a little bit more difficult as well. But we had to sit down and make decisions. And it's hard when you're sitting here, a doctor's surgery, and he says, what do you think? But there's a lot more to it than that. You've got to go away and talk to family about it and then make the decision. Even though it's your decision, that's the way we're taught to do things, is family or mob, whichever way you want to call it.
Yeah, and I agree that some of the things that we help the doctors and nurses here understand is that a patient's not single. They are part of a family, and decision making is sometimes family. While we see it as the patient, Western way say you're the patient, you can consent, but it's actually a family process, isn't it?
Yes. But the other thing I found too, even though I was having problems on the mob side, I found that the staff were very good. The nurses that I had in the radio section downstairs, they seemed to be caring. they took into consideration the hassles I was having.
Yeah.
I slowed them down a bit a few times, but
Yeah.
they understood what I was going through, which was good.
And so, because you lived in Canberra, it made it easier for you, by the sounds of it. So, someone coming from interstate.
Yeah, unless they've got somewhere to stay or they've got mob here or something like that,
Yeah.
it then becomes very hard to
Yeah.
do it. It was also understanding what happens. In my case, I had to have a full bladder.
Yeah.
And by the time I left home and got here, then I had to go, then I had to fill, and that's what slowed them up a bit because...
Yeah.
But they were all understanding about it, which I thought was better patience than I had, putting up with a cranky patient like me. Well, I don't know whether I was that cranky, but...
Oh, you're easy.
You're under stress. That's not so much you're cranky, you're under stress. And that's... and having someone to talk to. See, I had my wife and family, but if I'd had somebody else or other members of the mob, it probably would have been less stressful.
Mm-hmm. So that leads us really nicely into my next question. It's about how can the Aboriginal Torres Strait Islander Liaison Service provide better support to you, or how can that help cancer patients in their journey?
Well, I think it helps that you're talking to somebody that knows Aboriginal culture.
Yep.
And it makes it easier. They understand where you're coming from, whereas if you talk to a non-Aboriginal person, they think, oh, well, yeah, get over it. This is how it should be done, but our culture is different.
Mm-hmm.
And that's why the liaison officers are very good.
Yeah.
So.
I guess for me, also too, it's walking the journey with our patients.
Yeah.
And being there when it gets tough.
Yes. I had a good experience with Colin, who's now retired.
Yeah.
I found him good. You could talk to him, and I don't know whether he'd ever been through it or not, but he seemed to understand where I was coming from and could sort of calm you down a bit and put a bit of logic into where you were going and what you were thinking about. Yeah.
So that's really useful that we can do that.
Yes.
Okay. So I guess then, for all these things to support you, tell us why you think it's important that Aboriginal Torres Strait Islander people are identified when they come here.
We're different, and I don't mean in a weird way, but because our culture is different, and they identify, and then if they've had that sort of training about culture and what happens with us and what we go through, it makes the journey more tolerable, if that's a way of putting it. Yeah. My experience with it, and I visit this hospital quite a lot with all the problems I've got, and even though I'm in 5 different departments at different times, and I've had the different Aboriginal liaison officers come and see me, so I haven't had the one, and they're all brilliant at what they do and the way they talk to you, and they understand your culture, so you can sort of say things and they understand, where I found sometimes if you talk to others, they don't really understand the culture and why you need family and the mob around you. Yeah.
So you don't have to explain yourself.
No, you don't have to explain it, they
it's
know.
understood. There's a common ground.
Link between you about, they're on that journey with family and mob, and you're on it, so they're now trying to bring you together and take you through the tough time you're going through.
Sounds like it's really important that you get asked that question so that you can have those links to us.
Yes. I've been asked every time I've come here, they've done it in a polite way. Yep. I've had no one being aggressive to me here yet, which is good. And same with when the ALOs come down, they ask, oh, do you mind? Do you want to talk? They just don't barge in and go, this is what's going on. So they're very polite and come across as caring in that role. And I think it's a good service.
Thank you. And I didn't pay you.
Oh, gladly get the bill.
How to ensure the doctors and nurses have an understanding of our culture and the nuances that we have.
I think that would come back to some sort of staff training mechanism. They don't have to go right into what our culture is, but if they get a broad stream of what it is, and then they can understand what we're going through and why it's important to have family and the mob there to come and not just get all uptight because 10 people turn up.
Yeah, which is the case.
Which is the case, yeah. And sometimes they can be noisy.
Yeah.
I think that'll come back down to staff training by the hospital. They don't have to do months and months of exams, just a cultural thing for probably an hour or so, just to let them know this is how the Aboriginal society works.
Yeah. So, as we come to the conclusion, is there a last message you would like to give us?
It's got to be give and take on both sides, like from the Aboriginal side and the staff, because the staff don't always understand, and I don't think they're being nasty or racist. Well, I haven't struck it yet anyway, but I think that it's got to be give and take. You've got to look at their side of it. They're there to make you better. You're there to try and get better, but then understand what they're talking about. And I think if the staff talk to you, they've got to talk in layman's language, because I'm not a medical person. I found when I was going through mine, they might as well have been talking French or something, because I didn't have a damn clue about the medical side. And I remember I said to one of the doctors, I said, mate, talk English so I can understand you. He said, well, I'm talking English. I said, no, you're not, you're talking doctor talk.
Yeah.
And I don't understand doctor talk, especially when you're telling me I've got cancer and all of a sudden I'm going to die. I've been through that. My first wife died, my sister died, my mother died. And now I've got it. So I've been through this journey of cancer.
Yeah.
So I can speak from experience about what it does. And I know it really hurt my youngest son, because at the time he was only 6 or 7 when his mother died. And he really got screwed up through going through it. So a bit of give and take. And the doctor I had at that time, he was quite good as well. So, but in those days, we didn't say anything about being Aboriginal, because I grew up in that time where if you said anything, you got taken away. So the whole family kept it quiet.
Yeah.
I'm getting a bit emotional now, but and that's what happens.
Yeah.
And that's still in the back of your mind sometimes when you're talking to people. That do I say too much, or what happens? You know?
Am I making the situation worse?
Yes.
Are they going to listen to me because I'm an Aboriginal man?
That's right.
Are they going to prejudge me?
Well, I've had that done, not through the medical system, but outside the medical system. I've been prejudged. Like, I know this thing, but I got some new glasses at Christmas, and the guy said, "You're Aboriginal." I said, "Yes," but you don't look it.
Yeah.
And I went, "Well, yeah, my third great grandmother was full-blooded Aboriginal. What am I supposed to look like?"
Yeah.
And that's the part that hurts, when they say things like that to you, and you're thinking, well, do I have to get it tattooed on my forehead or something? As I am.
Thank you. There was a couple of messages in there. I'm just going to recap them.
Yep.
And to make sure I've heard right. One is, if we say we're Aboriginal, accept it.
Yep.
Don't challenge it.
That's right.
And two, this is a scary journey to be on, and to use language that everybody can understand.
Yes.
And knowing that inside a patient might be looking calm, but actually melting down and freaking out inside, and therefore hearing big words is not something we can muddle through.
No, it's got to come down to, I guess, like they do with the insurance policies, plain English.
Yeah.
So that you can understand what they're on about.
And that there's give and take on both sides.
Yes.
So they're 3 beautiful messages.
And I'm not asking for special treatment.
No.
I'm just asked to be treated as an Aboriginal man and understand where I'm coming from, as I've got to understand where the medical staff are coming from, so that we meet in the middle and have a good journey.
Oh, thank you so much. And I think they're 3 powerful messages that we can take on.
Good.
Thank you.